Three, two. Hello, everyone. Y'all have no idea how excited I am today. I'll be real honest. Dr. Weiniger and I really should just schedule like a 30-minute coffee break every week because I get so excited talking to him. And I looked up and I was like, oh man, it's time to start the webinar. Not that I don't love hearing everything he has to teach, because I absolutely do. If you are in Florida and you are attending a Florida event or any of the events that he is speaking at, we were just talking about this. I tell him all the time, no one has more fun in any class, certainly not mine because I'm always talking about compliance. Um, but nobody has more fun in a class than if you're in Dr. Weiniger's class, because hands down, he's like the most fun when he's sitting there teaching you great new things that you can implement in your practice. And today really isn't going to be any exception. He really is the expert on posture, which is such a huge, important thing within this profession. And as a mother, I was just telling him it's like one of the most important things to me when I am taking my children to the chiropractor on a regular basis, also because they're kids and they tend to do all kinds of things to that beautiful spine of theirs. So anyway, I'm going to quit talking, but anyway, he spearheads posturemonth.org, a global public health education on the impact of poor posture, managing partner of posturepractice.com and bodyzone.com. He is absolutely amazing, and again, one of my most favorite people of all time within the chiropractic profession, and certainly my favorite class to attend at any event. So welcome, Dr. Weiniger. Thank you so much for sharing your wisdom and fun with us today.
Christy, thank you very much for those kind words. I truly appreciate it. And even though I'm not going to see you at the Florida Chiropractic Association next week, week after next in Panama City Beach, or the one in Miami, the one after that, I look forward to seeing you at the National. And at the National in Orlando, we're also having our CPAP homecoming and a little cocktail party. So please come by. I'd love to have you come there as well. I'll talk to you about it when I see you there. And everybody else, welcome. My name is Stephen Weiniger. If you don't know me, they call me the posture guru, posture expert. We teach doctors how to position themselves in their practice with posture using current research as well as current communications and marketing concepts to engage people. Things like Christy talked about kids. The Posture Zone app is an amazing tool. Instead of having a line on the back of a drawer, taking an annual posture picture and letting the parents see not just how much the child is growing, but how tall the child is staying as they're growing. And when there's a problem, being aware of it so they can do something earlier to help to strengthen their posture. And when there's a problem with pain, seeing a chiropractor to return the motion so that they can move well. And so I wanted to share with you some of the research that is coming out that is truly inspiring for the things that I've been talking about for as long as you've known me and anyone else in the profession, but the past dozen plus years. This came out last month. That chiropractic care was tied to a significant reduction in opioid prescriptions. And this was done at the annual meeting of the American Academy of Pain Medicine. And there's been a couple of small studies that have suggested that chiropractic care correlates with reduced opioid use. And so the conclusion has been that it may negatively affect opioid use if you go to a chiropractor. Especially because chiropractors provide many of the treatments, including the clinical guidelines for low back, neck, and arthritis in the hip and knee. And they're building on the guidelines such as the 2017 American College of Physicians pain guidelines that recommend manipulation for both acute and chronic back pain, as well as subacute, as well as recurrent. And they recommended chiropractic over, not just opioids, but any drugs, over NSAIDs. And this was on the front page of a lot of things in the media, including the Wall Street Journal. But this was the first systematic review to see if a DC, seeing a chiropractor, actually reduced overall use of opioids. They looked at 62,000 patients from a half dozen studies from all available literature, and they found that chiro utilization ranged from 11% to 50%, but chiropractic opioid use was a lot less. Patients seeing a DC for a neuromusculoskeletal condition that involved pain were 49% less likely to get a prescription for opioid when compared to similar patients. And this was not just at the beginning, it's the choice of which doctor they went to at first made a difference in whether or not at any point in the management of that problem they saw an opioid. They needed an opioid from a physician or from the person's behavior to go to a physician. And this was in Medscape. And one thing I really do need to point out is some of the public health awareness campaigns that happen are being, in my mind, less objective. From that presentation at the American Academy of Pain Medicine, the Medscape had a physician, Ann Hansen at the University of Washington, comment on it. And she said that muscle pain and dysfunction are the most common etiologies for back and neck pain, and it's best when addressed with conservative care. And they said that the importance of complementary medicine, PT, chiro, and movement therapies were well recognized as a first-line treatment for common neck and back pain. So this is saying that the things that I think are to be true are true. But then the commentator went on to say that there's little scientific evidence to support the specific application of these modalities, and that chiropractic management is not limited to manipulation, but also may include other manual therapies, such as muscle therapy or IASTM or any soft tissue tool, massage, and exercise. And they went on to note that assessment of the impact of these diverse approaches is beyond the scope of this study. So therefore, we need more research, and the final conclusion was it's important to remind people suffering from MS pain to consult their physicians for a thorough medical evaluation prior to adopting a chiropractic program or exercise regime. And the reason for that is what we just talked about a moment ago. Because chiropractors use a lot of different kinds of therapies, there's not been studies demonstrating chiropractic and massage, chiropractic and posture exercise, chiropractic and strong posture exercise, because that is not a study that looks at everything. Then you should go to a medical doctor first, which is, to me, supremely illogical. And this is the point I want us to be aware of, that there's improvements in communication and there's work that's being put out that isn't true. And pointing at it, commenting on it, talking about it online is a good thing to do, especially when you look at the amazing research that's coming out that's promoting the ideas that chiropractors have talked about for a very, very, very long time. This came out in 2018, the inflammatory response and the regression of the lumbar disc herniation. And yes, lumbar discs are a big problem affecting 9% of people. And the difference between a bulging, protruding, and extruded disc versus a sequestered disc where part of the nucleus is going extra disc and going into the canal is something that chiropractors are aware of. And chiropractors have dealt with the problem of herniated discs are found in 30 to 40% of asymptomatic people. This is why if there's a disc that there's a bulge, it's not necessarily saying that's what the problem is. What the study looked at was that lumbar disc herniation commonly will have a spontaneous resorption, and it's well documented in a bunch of studies. And spine surgeons are becoming increasingly aware of this phenomenon and may recognize the usefulness of conservative treatments for lumbar disc herniations and advise patients accordingly. And this is where it gets really interesting. The MRIs shows that the lumbar disc herniation regression, basically the bulge going away, is more related to the presence of transligamentous extension and not so much to the size of the herniation. In other words, if some of the disc goes outside the canal, that goes outside the disc itself, outside the annulus, and escapes into the canal, it's a better clinical condition. It ends up healing more quickly. If someone had a sequestered disc, that they completely resolved it for 9 months, according to a benchmark study by Takuda. Extruding discs resolved within 12 months. Discs that were protruding after 12 months showed little to no signs of regression, regardless of if people had symptoms or not. And so this resorption had been associated with dehydration and shrinkage, but now new studies and looking at a number of different facets, the observation that the disc is an avascular organ and it's an immune privileged site and it's isolated from the immune system. And so the theory that that creating new blood vessels is the big factor in the resorption of the extruded disc. And that process involves inflammation. And this is from the conclusion of this study that was published in the Arthritis Journal. It's clear that the inflammatory response that occurs associated with lumbar disc herniation is crucial to its spontaneous resorption. So taking anti-inflammatories isn't innocuous. In fact, it creates the chronic problems sometimes. And their bottom line conclusion, inflammation in this specific clinical context is a good prognostic indicator and should not be halted because it may ultimately lead to reduction in cost overall and improving the clinical symptoms. And concluding that unless conservative treatment is contraindicated for reasons such as a neurologic deficit and intolerable pain despite adequate pain medications, different forms of non-surgical treatments should be exhausted before considering surgeries in the acute stages of lumbar disc herniation. And so the most recent pain study that we talked about a second ago is being, to me, demonstrating that that chiropractic can help reduce the need for opioids. But even more than that, seeing a chiropractor first, doing manipulation and other soft tissue therapies first, should be completely exhausted before you consider surgery. And this is where I come in. I talk about posture rehab, not just try to stand up straight, but to rehab posture. And there's other people in the posture rehab space. But the strong posture approach is designed by a chiropractor. That's me, because I practiced for 26 years in a real life practice. I didn't graduate and take everybody else's course and try to copy this and copy that, but the stuff that we do works, as tested to by literally doctors in, I think, 27 countries globally and just about every U.S. state. But this study that was done recently did not look at our protocols, but this was a 2019 study that looked at Pilates, Back School, McKenzie, Feldenkrais, Alexander's, and a couple of others. And they all were effective with respect to the control that was standard rehab exercise. They all looked at breathing, and they all gave a behavioral or biopsychosocial approach. However, the difference with strong posture and the difference with chiropractic is both enable facilitation of unused subtle movement. Cool study came out way back in 2018. And the title of the study is Trunk Postural Balance and Low Back Pain, looking at the relationship with clinical changes following a lumbar stabilization exercise program. And they found that only the quality of movement was important to the recovery, not the amount of movement in terms of the pain as well as the disability. So it's not the overall range of motion, it's the accuracy of coupled movement. And coupled movement is how one bone moves with the other at a level. It's working with the spine, and there's a fixation between L3 and L4, and you look at them bend, and it's not quite smooth. There's a bit of a skip at that arc of flexion. You adjust them, it moves better, it moves more smoothly. That's what chiropractic does on a segmental level. It restores motion. Of course, it does other neurologic things as well, but on a minimal level, you're restoring segmental motion. Integrating training to reliably retrain that movement towards accurate symmetry is what we talk about. And that's what strong posture is about. And the idea that it's not just exercising, it's how you exercise. NPR had a great thing about sitting in back pain, and that studies have shown that even if you engage in regular exercise every day, it may not be enough to counteract the effects of too much sitting throughout the day. And that people that sat more were literally more likely to die. Which brings us to the big public health message. Ace your posture. Be posture aware. Know what your posture looks like, because that's the gateway to making people more posture conscious. Take control of your body, teach your body how to move, doing strong posture exercise or other posture exercise. and optimize your posture environment, how you sit, stand, move, what kind of orthotics or shoes you're wearing. That's all part of how your body exists within your physical environment. So May is Posture Month. If you are not signed up for our Posture Month messaging, we'll be doing a webinar on that. But go to posturemonth.org and check it out. It's a program especially for people that are certified posture exercise professionals. That's CPAP, that's the certification that we do, that help promote strong posture out in the world. And there's so many things, so many cool things going on that are giving validity to the idea that posture and the awareness of posture can affect not just pain, but self-image. But pain is a big thing. In fact, they this was also in 2018, validated a questionnaire, an instrument to correlate awareness of body posture in patients with chronic back pain. Because one of the challenges of looking at posture is studies don't always support, this is their words, the notion that MS pain is associated with body posture. Someone may have what looks like poor posture but no pain. Someone may have what looks like good posture, okay posture, and being horrible pain. And nonetheless, studies have shown that improving habitual postural patterns might lead to improvements in MS pain and could prevent other issues that become more chronic. So for people that looked at the study, observed and looked at a bunch of different things, they concluded that changing habitual patterns requires posture awareness. And here's the kicker. It's not just how you think you're moving, it's how you really are moving. That's why creating a more accurate awareness and then teach people how to move differently. In their study, showed an association between the pain intensity and how they were able to function. And basically, there was as they put it, a negative association between those two. So, in other words, people that had greater postural awareness had less symptoms if they were chronic pain patients. If they were less postural aware, they had more symptoms. And if there was something was done to improve their postural awareness, that was associated with reduced pain in these patients, which is basically cervical spine, upper thoracic spine, and shoulder pain. And this was the first study that really put together the melding of the biomechanic and the biopsychosocial and habitual with a validated instrument. The point they're making is getting people to be postural aware has a true clinical value. If you know any of the work that we do, my book Stand Tall, Live Longer, creating that awareness begins with a picture for the clinician, because a picture's worth 1,000 words, especially when you can't connect that with the biomechanics of their pain. And that's why I designed the Posture Zone app, to help people observe the accuracy of how they're standing when you make them self-aware, and observe the accuracy of their symmetry when they think that they're standing tall, by measuring how 4 posture zones, the 4 body masses of head, torso, and pelvis are balancing over the feet, and measuring the degrees of deviation between those 4 masses and where they're standing. When you're taking a picture, we recommend having a standardized grid in the background. That's a portable grid. In the office, I suggest a wall grid. It's hard plastic and it's an exercise station as well. But any way you do it, getting a standardized background to measure where the body is. The instructions that we suggest for a picture is stand tall, show me your best strong posture, and here's a subtle point that's really key. You are creating a benchmark, a baseline, for a self-aware documentation of their perception of their best posture. And one of the things that we talk about is there is chronic and recurrent pain that occurs. One study that was done in 2013 is an older pain, is that when you look at chronic low back pain people versus looking at normals, looking at the fMRIs, there's a recruitment of, hold on one second. There's a recruitment of the lumbar multifidus, the erector spinae, the QL, and the psoas when someone has an adaptive motion pattern. However, when you're looking at the fMRIs, significant changes occur only in the multifidus, which is the deepest spinal muscle between the vertebrae, which is a one-joint muscle. It's not a multiple joint. It's only in one joint muscle. And it senses position and controls subtle patterns of spinal movement. And this is one of the key points that I've talked about in multiple things as well. They find alterations in the multifidus structure and activity in unilateral recurrent back pain, even when the people were pain-free and asymptomatic. Okay, so how does this fit in? Getting interesting, I think. Exercise is important. The question of, can motor control be retrained with exercise? Okay. Oh, okay. No worries. Okay. No, the spine is controlled by a complex interplay of many different muscles, and that might be the reason why the different kinds of exercises differ. And there's always been this disagreement between the motion people and the exercise people. Hodges and some of the people that I really respect talk about the deep core and the inner core and the transverse abdominis, and some approaches target the deeper muscles, such as Hodges' approach, whereas others like McGill and Sauerman talk about correcting faulty patterns of movement. And this is what things going on in the research world and in the scientific world. And I'm a chiropractor. I graduated from chiropractic school back in 1979. I practiced in the 80s for 26 years. And there's a amazing difference between what a chiropractor does and what everybody else is doing with rehab, because we are also facilitating segmental motion. So the answer is not an either or, it's an and. They both fit together. But if you're going to restore segmental motion, you need to systematically retrain it, because the body is not going to passively work motion that it hasn't been using for possibly a long time in a chronic condition. So back in the 80s when I practiced, chiropractic was largely about manipulating the spine, maybe some soft tissue work, maybe some extremity work. And that was the 1980s practice model. In the 1990s, people started talking more about functional restoration, adding rehab to that. And that's when I got into the rehab world, where once you got them out of pain, then over time you did more and more functional rehab to improve the condition. So it was a passive care for pain relief and an active care for functional restoration. That's where we were in the 2000s. In the 2010s and going forward for the 2020s and the 21st century, chiropractic has an opportunity to build a different kind of practice model, integrating passive care and active care with posture care, and having posture care be something that looks at the quality of the movement and the focus being on an individual's unique subtleties of movements. Yours are different from mine. We move subtly differently. And having the clinician retraining that towards symmetry and communicating that improved quality of function to that individual, communicating that with concepts to educate people and engage them and empower them in a way that makes sense. Things like concepts of using an app to look at where and how your body is balancing to build consciousness. And the rehab that we talk about to do that is called the Strong Posture Exercise Protocol. And that's the movement that we talk about, to go from awareness to consciousness, because that opens the door to position the chiropractic adjustment as an intelligent biomechanical anti-aging life habit to move, feel, and be well. And the CPEP is the logo that you see in the upper right-hand corner, Certified Posture Exercise Professional. That's the Body Zone certification, and that's the locator that's built into the Posture Zone app to help people looking for a posture professional or someone that is thinking of looking for someone with posture. We come up in searches for this in a bunch of different ways. What if people thought of chiropractic when they thought about posture? And what if there was an explanation that helped people to stand taller and to move well for real? That's what Posture Zone is about promoting. And connecting with things like Haig's textbook, after decades of low back pain research, it seems we still do not know how commonly used low back pain treatments work and for whom. Randomized controlled trials don't show the effects expected, and the problem that they have with many others is population selection, getting the right patients. This is Hyde's own words. And on correcting posture, which is the base of a lot of this, the conclusion is we may need to reconceptualize the research framework in the field of low back pain, because my words are people with different bodies and different histories have different pains. They're similar, but not quite the same. This body works the same, but the way they move is subtly differently, which makes the pain subtly differently. But the body moves in similar patterns, so the things that happen are part of a spectrum. And coincidentally, this is something that we've been talking about for a while. This came out in 2018, I believe it was also. That's fine, 2017. And they compared total atrophy and lean muscle mass for recurrent low back pain, RCBP, non-continuous low back pain, comes and goes, and continuous chronic low back pain. And they found that there were changes with it, but that there's a continuum of loss of muscle mass that makes it, all the stuff going on with back pain, be part of a continuous spectrum. In other words, it's a spiral that keeps on degenerating over time. As people move differently, there's another episode of pain, they move more differently, and things break down. Because the muscles are ultimately what's moving the body. In fact, last year in Spine 2018, they came out with a muscle grading schema for qualitatively grading muscle fat infiltration and whiplash using MRI. If you're doing any kind of PI work, if you're keeping a baseline on people, this is a really great way to set a long-term baseline. This just came out in 2018, and it's one of the things that we're working with now as well. Different studies are also showing that lumbar stabilization exercise programs can make a difference in pain and in their movement sense. But this one study had the conjecture that different impairments, if there's atrophy versus just inhibiting activation, that this is going to affect clinical outcomes differently. The same people did a similar study with the hypothesis that lumbar stabilization exercise can reverse atrophy in specific muscles. But they found that there was ability to change the muscle activation patterns, but it didn't necessarily normalize the impairment. And this study looked at a bunch of different patterns of movement, and they looked at how each trunk segment moved, and they looked at how one muscle relaxed and one muscle when another muscle was contracting, which is the flexion extension response. And they found that measuring the flexion in the spine and putting inclinometers at different points, that there was different patterns that people moved in. In fact, patterns is one of the 5 posture principles that we talk about in Stand Tall, Live Longer. Your body's chain of motion follows the path of least resistance. When you're looking at these patterns, they found that people that had back pain didn't move the same. They all moved differently with different patterns, but they weren't moving smoothly. They weren't moving with symmetry. And this is one of the problems with just doing lumbar stabilization exercise. In this study, they found that patients learned to stiffen the lumbar spine during the lumbar stabilization exercise. For example, doing a pelvic neutral exercise for pelvic tilt. And that technique was applied even if the pain and disability unequivocally decreased after the treatment. In other words, locking in a neutral pelvis made it feel better. So you always locked in the neutral pelvis because that's a better way to do it. And their conclusion is that's not necessarily beneficial to the patient. Because especially for those segmental motions that are controlled by the segmental muscles, like the multifidus, that according to the prior studies that we just talked about are the only ones that are really, really key in terms of showing changes with chronic lower back pain. If that multifidus is atrophied, they are not going to necessarily start to move differently. If the segment is not moving, even if the pain goes away, if they've learned to feel better by locking motion across an area, the muscle that should be stabilized in that area just get weaker. And if there's been a long-term fixation or any other kind of mechanical story going on at a level, my experience and probably yours as a chiropractor shows that these don't get better by themselves very often, but they often get better dramatically and effectively when you give somebody an adjustment. And this is, to me, the uncommunicated value of what chiropractic can be contributing. And this is where I want to help my profession, my colleagues, my friends, to strengthen posture as part of what we're communicating to people, as well as talking to other clinicians in the world. I had to leave for a second a moment ago because someone knocked on the door of the conference room that I hijacked. I'm in the conference room of a hospital right now, and we're talking about working with local chiropractors as well, to integrate posture awareness and motor control. The strong posture exercises that we teach build a virtuous spiral. Instead of spiraling down, spiraling up to strengthen balance by strengthening alignment, by strengthening emotion, to in turn strengthen balance. The balance is the beginning of posture. The posture is how you balance your body, and the strength of your balance is how well you know and can control where your body is in space. And that's what we talk about with CPAP and the Certified Posture Exercise Professional Program. The body moves in patterns of movement. The public health message is ace your posture. Be aware, take control, and optimize your environment. And having a posture awareness that helps people to move differently means that when you take a picture, they're able to stand taller, which means taking that picture builds awareness. Taking control helps them to move better, and then helping them to stand taller and move better means that they are more apt to take action at work to maintain that stronger posture. So benchmarking and empowering them towards more accurate posture awareness via training them to move with awareness, with symmetry, with accuracy, with coupled motor control as part of any rehab. At the beginning of any rehab, if you're rehabbing a shoulder, you want to strengthen their posture. If you're rehabbing a low back, you want to rehab their posture. You want to start all rehab with posture, because ultimately posture is how you balance your body and how you work in the entire kinematic chain. Focusing on one thing at a time, because when you think about it, how many things can you focus on at a time? Focus means looking at one thing, not looking at 6 things. The problem is there's 16 dozen things you're looking at with posture. By focusing on one track, balance, then alignment, then motion, and then moving the focus within that track up the kinetic chain by posture zone, from the bottom to the top, from the lower extremity to the pelvis to the torso, including the upper extremity to the head, to move with coupled motion and accuracy. It becomes a diagnostic as well to see where there's coupled motion that's not occurring properly and where an adjustment can make a big difference, as well as where there's sloppy movement that they're not controlling, that you can then help them to find that accuracy with strong posture, which is training them towards something externally objective, not how you think you're moving, but having a cue like balancing on a ball, leaning against the wall, balancing on one foot. Low-tech tools, but in a very systematic way. That's what we call must versus try cueing, to focus the individual awareness on their functional ability, which makes each protocol unique for the person, for the subtleties of their body, and which then becomes the jumping off point for any kind of conditioning. Because from an exercise point of view, every movement starts with posture. Every movement ends with posture. You exercise as you move. That's one of our share images for Posture Month. And if you like these messages, share these images for Posture Month. You'll be seeing them around. Our message is posture care is important. You want to get people to first move pain-free. That's the acute thing that chiros talk about. to move well. That's what rehab is about. And rehab, from a posture care point of view, begins with being aware of and being able to control strong posture, and then getting people to be well to their health habits, as well as having a public health message of strong posture habits for everybody. That's one of the big things we talk about, and that's why we have the whole Posture Month campaign. Spine Journal, this came out last month, I believe it was, in the beginning of March, in spine. And they looked at the relationship between end plate pathology and patient-reported symptoms for chronic low back pain. And they found that the lumbar paraspinal muscle activity and the quality of that muscle activity was key. And looking at all the different kinds of stabilization, they found that their results demonstrated that the clinically important, that there is a clinically important reciprocity between the passive and dynamic spinal stabilizers. And that supports the notion that therapies targeting the paraspinal muscles may provide a clinical benefit even in the presence of other spinal pathologies. So it's not this muscle or that muscle or this exercise, that exercise. It's getting it all to work together, which is the summary of what we talked about earlier in this webinar. This came out a couple of years ago, but it's also an interesting study because they looked at the impact of faulty posture on rotator cuff tears, both with and without symptoms. And they found that postural issues, postural, as they put it, abnormality, and they used a more primitive grading system. But even with a basic postural awareness benchmarking and tracking, posture was an independent predictor for both symptomatic and asymptomatic rotator cuff tears. So the more someone's posture flexed forward, the more likely it was that they would have rotator cuff tear. It might have hurt, it might not have hurt, but there was damage occurring to the tear. Whereas whether somebody had pain was not necessarily a predictor of whether they had a rotator cuff tear, although past pain was a predictor. And the awareness of someone's posture drives how they are standing. This is the goal of ACE, what we talked about before. The goal of ACE is to go from awareness that, yes, I should be paying attention to my posture, but you're not going to think about it all the time, to building a personal posture consciousness, of getting people to be conscious and connected with their body to stand taller by taking posture pictures. StrongPostureMonth.org promotes the May is Posture Month campaign, promoting the awareness, control, and environment ACE posture message. And the big part of that is, have you had your annual posture picture yet? Sending out an email to your patients, it's May is Posture Month, we're doing free posture pictures. And then teaching them how to strengthen their posture is something that makes a big difference. If you don't like the Posture Zone app, just use any camera and drawing lines on it with a magic marker if you want to. There's other things in the market that use the inches and actual metric degrees. I'm not crazy about things in that direction because, especially if you use that for kids, you're systematically adding a variance to what's occurring, because a kid that's 3 feet tall, when he doubles to 6 feet tall, is going to have twice the metric deviation, with no difference in how the body is balancing proportionally. But I'm prejudiced. We also help, if you do like to use the Posture Zone app, consider getting certified, because then the locator will tell people where you are locally, and you can use it as a great way to build a practice. It's a killer tool to engage people and get people excited by taking a picture of their posture and seeing how they're standing, what they look like when they're standing tall. And the rest of the year, the Posture app, Posture Zone directory for CPAPs, is on a number of our websites, including Posture Month, Stand Tall, Live Longer, Body Zone, and Posture Practice. And we have some other cool things coming up that we're working on now for 2019. That's one reason why I am where I am right now. I am not. You can't come to Walker Shore because I have not changed the slide yet. Next time we're going to be at is in Panama City. Then we're going to be in Vegas. If you have an interest in going to Paris, we're doing the 12-hour seminar for the first time, and in the chiropractic college in France. believe it or not, they have 2 campuses, 700 students in the Paris campus, and 500 students in the Toulouse, South France campus. But I'll be in other places as well. If you like what we're doing, check out Stand Tall, Live Longer. Dr. McKinley is one of our trainers, and you may have seen him around. This is one of the testimonials that we got from a patient that gets into doing exercises when there's a reason for it that they can do and they can feel a difference quick, and that you can then connect with what you're doing in a clinical way to help people literally stand taller and live longer. So if you want to investigate what we talk about, pick up a copy of Stand Tall, Live Longer. If you have an interest in getting certified, talk to us, because that's exactly what we do. If you want to learn more about what we do from an educational point of view, one thing that I'd like to offer to your people, Christy, is to save 25% on CE with the new CE Soup platform for continuing education. This is for the Strong Posture Protocols. There's 5 3-hour modules, 15 hours in CE. It's good for most of the states. Look online for your state. If you do it, right now I am on vacation. I'm doing this here, and I am going to be back home on Thursday. So when we go back home, it'll go back to normal, but you'll save 25% if you register for a CE Soup course between now and Thursday. If you have interest, or you can call the office online, because they're still there, even though I'm not. If you want information on grids, go to Posture Zone. Information on the Posture Zone app, download it for the iPhone or Android. If you have interest in our general health image for the public, look at bodyzone.com. And what you should have interest in terms of developing a posture practice for you, is posturepractice.com. And that's where there's information on the CPAP certification and the other tools that we use to promote posture. And so again, the coupon for CE Soup is ChiroHealth CPAP, posture practice. Give us a call. We'll be happy to work with you to get you to be the posture specialist in your corner of the world as well. But this coupon for CE Soup, which is only for the education, is good for Thursday. And with that, Christy, I wonder if I'm talking too slowly or maybe too quickly, but if anybody has any questions, I'd love to hear them.
I do not
Christy,
see any questions. I don't see any questions yet, but we'll give it just a minute. And I
should have said any questions. I'm glad you enjoyed. I always hate listening to a webinar where somebody is taking a breath and making me feel like I want to take a nap halfway through. It's like, give it to me fast, give me more information, I want to know more. And that's the way that I assume that you are, and that's the way that I like to put things out there.
Absolutely.
There's so much cool information.
So if you have any questions for Dr. Weiniger, please submit those now. Just a reminder, next week we have Dr. Tom Nasila on the 10 biggest factors that impact the value of your chiropractic practice when you put it up for sale. The following week, we're going to have the Queen of CA training, my dear friend Holly Jensen, talking about the 4 essential things you can do to reduce stress at the front office. And then my very good friend, Dr. Heidi Havoc, has been kind enough to talk to us about how to communicate science appropriately within your chiropractic practice. And I'm super stoked because her travel schedule is kind of like Dr. Weiniger's. She is gone all the time. And so she will be broadcasting live from London. It'll be 8 p.m. her time when we're doing our webinar at 2:15 p.m. Eastern time. And then we're going to close up the month with the Science of Sugar with Nicole Avina, a PhD, who works with Princeton University. So it's a great lineup for this month, and we've started posting for May and June on the website. So again, register early. I don't see any questions. I do want to say, again, if you have the opportunity to hear Dr. Weiniger live and in person, we do have a question that popped up. Yay. But I will say this. If you do have the opportunity to hear Dr. Weiniger live and in person, seriously, it will be the easiest continuing education hours you ever got because you're not going to fall asleep. It is not going to be boring. He is, as you can tell, absolutely fascinating. He is a wonderful presenter, but his class is so much fun. Like, I can't even stress that enough. It is so much fun, and we can't always say that when we're having to get continuing education hours because I have to get a ton every single year for my compliance certification. And I wish that we had somebody like Dr. Weiniger who taught an interactive and fun class, but I don't get that lucky. But you do, so don't waste that opportunity. Well, the question that just came in, what if you have a leg length difference or other physical abnormalities? Is app able to modify? That's a great question.
Good question. You can modify the baseline for app, and you can also add other additional lines. So one of the things that the base app observation is, and let me back up and show you a picture. I think I have probably the easiest picture to look at. Looking at both these views, we're basically bracketing the head, torso, and pelvis over the central pressure of the feet and measuring the angular deviation of those parts. In addition, you can add other variation lines to it, as well as do other things to the environment. So one interesting thing that we've done playing with, if somebody has a 1-inch leg deficiency, putting a 1-inch lift under them and taking a picture of their posture both with and without the lift. And I think that absolute symmetry is not necessarily going to be the best goal if someone's had a long-standing asymmetry that's trained the muscles and the neurology and the ligaments in a way that is asymmetric. That said, going towards symmetry is generally a really good idea. So it's a framework that you can adapt into a lot of different directions. But again, the other side about leg length deficiencies is functional versus anatomic. And if somebody has a functional leg length deficiency because of a PI problem or a pelvic problem or another spinal problem, I would rather have that as my initial benchmark because it's not about the picture, it's about the person. So getting someone's perception of what they think they are standing like when they're standing tall and working with them to facilitate symmetry of movement up and down the kinetic chain, that's what a chiropractor is supposed to be about, from my way of looking at it. So
well, and I will say this, I have played with the app, and Dr. Weiniger and I sometimes get really lucky and get to sit next to each other on airplanes. And we did spend one flight from Orlando to Atlanta talking about I am technologically challenged a lot of the times. Thankfully, I work with an amazing team of people who help me do things like start this webinar, and learn how to do that. But the Posture app is really easy to use for everyone on your staff. It is a great tool to utilize at health fairs and events and when you're doing exams. And those pictures, they say a picture says 1,000 words. When you're showing your patient what their posture looks like, trust me when I tell you, there is nothing more convincing than for them to see it for themselves. Like I said, incredibly easy to use. It's fantastic. I do want to remind everyone, too, to please go to posturemonth.org. Dr. Weiniger and his team, I'm telling you, they make it so easy to promote posture during Posture Month because they basically do everything for you, like everything. And the graphics and the information that they have available to help you to promote posture within your community all year long, but especially during the month of May, absolutely incredible. Absolutely incredible. So please check it out. Utilize this opportunity. This is something that you really can get this information from them and promote. Your staff can very easily plug it into social media. There's great suggestions on what to do. The toolkit is absolutely amazing. They really have, because Dr. Weiniger is a chiropractor, so he knows what it's like to be in an office, and he knows how difficult it is to find the time to be able to devote to things like this. So he made it really easy for you to be able to do that. He and his team, absolutely amazing. So please go there, make it a priority. May is 4 weeks away. Next question, does CPEP teach postural suggestions for scoliosis patients? Another great question.
Good question. Scoliosis is a whole other kind of a thing, and our focus is not correcting scoliosis. And there are some techniques that focus hard on scoliosis, and there's differences within that world, and that's a whole other subworld of posture. That said, we've seen a number of patients that just using, and this is not just us, it's from other CPAPs as well, that just adjusting them, unlocking segments, restoring the ability to move, and then retraining them to move towards symmetry has improved motion. I remember I had a girl come to me once that she was literally dragged in by a patient of mine that was her mom's like next door neighbor, best friend kind of thing. And my patient paid for this mother to bring her kid to me because we have to see Dr. Weiniger. And this young lady had, I believe it was a 39-degree curve. She was just turned 14 when I saw her, and she was told that if she got to, I think it was 42 degrees, they were going to put a Harrington rod in her spine because it was going to become a malignant curve, and they were concerned about it affecting her breathing. And both her parents were tall and thin, and she was long, but not nearly that tall. I think she was maybe 5'6" at that time. I think she ended up being like 5'11", and when she first came to see me, she was wearing a brace for, I think it was like 23 hours a day, 23 and a half hours a day. And I basically said, I don't know if we can help you. Let's give it 6 weeks and see what happens. We worked with her, and after 6 weeks, the big change, and this was before we were being as detailed with pictures, the big change that she had was that she wasn't being as rubbed raw by the brace on her hip, where her hip was high on one side. And her parents ended up continuing to bring it to me. And to make a long story short, over the next couple of years, we saw her systematically, from frequently to less frequently, but still consistently. She was doing posture exercises. The last time I saw her, she came to me as I think she was a college junior at the time. And the curve was at that point down to like, I think it was 13 or 14 degrees. And looking at her, you would not see anything that was anything other than a confident, attractive young woman that was standing tall. 13 degrees instead of 39 degrees. Now the difference is not having a rod, not having a brace. And the goal of the brace was not to reverse it, it was to keep it from getting worse. The baseline that she was starting with was 39 degrees. And the orthopedist that was involved at that time said that it was a spontaneous remission that happened sometimes with no explanation. And it was probably a coincidence that she went to the chiropractor and that we were teaching her screw and posture exercises. I know it wasn't a coincidence. So we do help scoliosis. My suggestion is generally do it on a trial. If you're doing other kinds of scoliosis techniques, it fits well with those as well, but that's not our main focus. Good question.
Last question is, how do I find a local CPEP in my community?
If you go to bodyzone.com, or if you go to download the Posture Zone app, or if you go to Stand Tall, actually Stand Tall Live Longer, we've been in the process of updating our different apps. And if you get the impression that we have a lot of different apps out there and different things out there, you're right. And right now we're in the process of updating everything and pulling things part of a larger technical framework that you don't want to know about. But Stand Tall Live Longer has the current directory, as does BodyZone, and as does Posture. I believe it's on PosturePractice.com as well. Or download the Posture Zone app, and it's in the free app. And the thing about the app, it's a free app. It doesn't cost you anything. Download the app, play with it, and there's a directory in the app. And we have it for Android as well as iPad and iPhone.
I want to thank everyone for taking the time out of their busy schedules to participate on today's webinar. Dr. Weiniger, I am so excited that you were able to fit this in your incredibly busy schedule, seeing as how you're at a meeting right now and you just took some time to do the webinar as well because your schedule is incredibly busy. So thank you so much from the bottom of my heart. And just know that I am counting the days until I get to see you in Orlando for FCA National.
I look forward to seeing you then. Christy, thanks a lot. All have a great afternoon. Thanks a lot, all.
Everyone, y'all have a great day. We'll see you next week with Dr. Tom Nasila as we talk about the value of your practice. You have a fabulous week. See you next time. Bye-bye, everyone.
Christy,
Dr. Weiniger?